My name is Jade White, and I'm a rising fourth-year biomedical engineering major with a minor in astronomy at the University of Florida. The research I will be discussing today is targeted nanoparticle delivery for osteoarthritic cartilage. What is osteoarthritis? Osteoarthritis is the leading cause of disability in the U.S. It is characterized by tissue degeneration and synovial inflammation. 1 in 4 U.S. adults suffer from a form of arthritis, with osteoarthritis being the most common. Along with the physical limitations, there is a substantial financial burden of $11,000 a year. OA is typically referred to as the wear and tear disease that impacts adults as they age. As the body gets older, changes in the cells cause gradual degeneration of cartilage. It occurs frequently in the hands and hips, but our research will be focused on knee OA. While it is common in adults, further studies have concluded that certain circumstances increase the risk in young adults. Individuals participating in the military or vigorous sports have an increased risk of developing post-traumatic osteoarthritis, often due to high levels of impact and torsional loading in the joint. Common traumatic injuries are ACL tears and meniscus tears. As seen in the bottom right image, the medial meniscus acts as a knee stabilizer, and when torn, destabilizes the knee, causing extra pressure and increasing risk of further cartilage damage. Treatment options available for OA. Treatments currently available include over-the-counter oral painkillers such as non-steroidal anti-inflammatory drugs, walking aids, intra-articular cartilage injections, and total knee replacement. Although the first 3 treatments aid in relieving pain, pressure, and inflammation, they all have one end result, a total knee replacement. When cartilage is damaged, it does not regenerate. There is no current application that is able to fix the underlying issue that causes these symptoms. All we can work toward is a better delivery system for those already suffering the disability and OA prevention for those at risk. Intra-articular injections are the most targeted mechanism currently available, but they do have many limitations. There is poor bioavailability in the joint space, short therapeutic effect, and the need for daily injections, which is not very practical. The image shown below, there is an example of an intra-articular injection. Nanoparticles are now being studied to carry a non-soluble drug in a polymer that is able to degrade and diffuse the drug into the cartilage. Here we see that while some of the nanoparticles do stick to the cartilage, many are headed toward that joint clearance, caused by that low bioavailability. There is not much particle uptake, which is why a painting application will be studied. If nanoparticles are able to be placed directly onto cartilage after an injury, this should in turn increase particle uptake and provide cartilage protection. PGLA nanoparticles loaded with resveratrol are the foundation of the research being conducted. Polylactic coglycolic acid, or the PLGA polymer. PLGA is an attractive copolymer used in degradable sutures as well as drug delivery systems due to its biocompatibility and biodegradability. PLGA is synthesized by ring-opening copolymerization of 2 different monomers, glycolic acid and lactic acid, both of which can be metabolized by the body. Ester linkages of PLGA enter hydrolysis in the presence of water, leading to its degradation in the body. Degradation rates typically are correlated to the monomer ratio used in production. Higher content of glycolide units lead to a lower degradation time. We want that lower time because as soon as an injury happens, we want to be able to protect the cartilage as quick as possible. In the image below, we see a PLGA particle going through drug encapsulation and conjugation. For our research, we are not focused on conjugation and we are focused on the encapsulated drug. We see that the encapsulated drug is in the nanoparticle, so as the PLGA wears down and diffuses that encapsulated drug, it will be able to penetrate further into the cartilage. Resveratrol as a cartilage protectant after joint injury. Resveratrol is an anti-inflammatory drug used to slow down cartilage degradation in patients suffering OA. Some of the mechanisms responsible for this include the inhibition of IL-1 beta by lowering expression levels. IL-1 beta is a biomarker of inflammation and is seen as pro-inflammatory. If we can lower these expression levels, we know that resveratrol is doing its job and acting as that anti-inflammatory drug. Along with this, we want to see a reduction in nitric oxide levels in the synovial fluid. Nitric oxide is a normal joint, regulates inflammation as a healing agent. But in a not so healthy and toxic environment, nitric oxide remains open and causes chronic inflammation. We also want to see a decrease in caspase 3-9 activity. Caspase 3-9 is responsible for cell breakdown. As soon as the body sees that the cartilage is damaged, it wants to get rid of it. In our case, we want to preserve as much of the cartilage as possible because it will not regenerate. So decreasing this activity is very important. It is also very important in reducing apoptosis rates of chondrocytes. Chondrocytes are the only cell in the cartilage itself, so we do not want to kill any more than are already being damaged. Resveratrol is also hydrophobic. Because of its hydrophobicity, it will not absorb into the body itself. It needs that PLGA polymer around it to be able to further diffuse into the cartilage. In the image shown at the bottom right, we see many of the applications of resveratrol throughout medicine. The ones that we are focused on are modulation of cell proliferation and apoptosis, as well as suppression of inflammation. The project aims to answer two essential questions. 1. Do resveratrol-loaded nanoparticles improve cartilage protection in the joint? And 2. Does improving targeted delivery systems further enhance therapeutic effect? Overall, we want to understand the effect resveratrol-encapsulated PLGA nanoparticles have on chondro protection. Next, we will talk about the methods and formulation of PLGA nanoparticles. This happens through a single emulsion solvent evaporation method. PLGA and resveratrol are dissolved in an organic solvent chloroform to create the organic phase. The aqueous phase is then created by 2% polyvinyl alcohol and 10% polyallylamine, which will be mixed to create a surface stabilizer. Next is the emulsification by sonication. The organic phase is going to be mixed with the aqueous phase to perform an oil-water type of emulsion. The probe sonicator produces sound waves that vibrate the particles and can lead to further mixing. Next, we will have solvent evaporation. Chloroform is very toxic to the body, and so we want to make sure that the chloroform is evaporated and left PLGA nanoparticles. Next is nanoparticle aqueous suspension. Particles are collected through ultracentrifugation and washed to remove stabilizer and free drug. Lyophilization is then used to evaporate the water and leave us with those dried nanoparticles. After nanoparticle synthesis, we move into nanoparticle characterization. The first step is dynamic light scattering. We will use dynamic light scattering, or DLS, to find the hydrodynamic diameter, as well as the zeta potential, which is the outside surface charge. Because cartilage is negatively charged, we want these particles to be positive. We will then go into high-performance liquid chromatography, HPLC. This will give us our drug loading efficiency. After that, we will do in vitro and biochemical assays. In vitro viability assay with chondrocytes and cartilage explants, as well as reverse transcription polymerase chain reaction. Goals and expected results. The overall goal of the project is to create a direct nanoparticle application using a painting method that will prevent cartilage deterioration after traumatic joint injury. Short-term goals include 1. Synthesis and characterization of nanoparticles, 2. Imaging analysis of nanoparticle uptake in cartilage explants, 3. Computational models of particle diffusion. Some of the key experiments were mentioned in the methods section, with addition to the painting application of the nanoparticle system onto cartilage explants. The following 6 weeks of the summer internship will be focused on Goal 1, synthesizing and characterizing particles and their chondroprotective effect. I would now like to express my gratitude to Dr. Sharma, my research mentor, for the opportunity to be part of the PLGA nanoparticle project and her constant support. Jessica Aldrich, my graduate student mentor, for her guidance and willingness to aid me in completing research successfully, and the McNair staff for the opportunity to participate in the program and provide the resources I need to be successful in a PhD program. And here are my references.